Review the patient's medical record for baseline data and factors affecting vital signs before taking them. Next, gather all necessary equipment and ensure that each item is functioning properly. Perform hand hygiene and follow standard infection control procedures. Introduce yourself to the patient and verify their identity. Explain the purpose of assessing vital signs and how the results will be used to plan care or treatment. Ensure the patient's privacy by closing the curtains around the area and, if possible, the door to the room. To begin the vital signs assessment, the patient's body temperature will be measured using the axillary method. Position the client appropriately, either in a supine or sitting position. Move the client's clothing to expose only the axilla and check if the axillary skin is dry. If it is moist, gently pat dry using a cloth or tissue. Place the tip of the thermometer in the center of the axilla and wait for the device to beep. Once the beep is heard, remove the thermometer. Read the temperature and inform the patient of the result. Clean the thermometer as per protocol and return to its container. Record the findings. Next, the patient's pulse rate will be assessed to evaluate heart rate, rhythm, and strength. Move the client's clothing to expose only the wrist area. Place the index, middle, and ring fingers over the radial artery. Lightly compress the artery to feel the pulsations. Using a watch with the second hand, count the number of beats for 1 full minute. Observe and note the rhythm and amplitude of the pulse. If any irregularities are noted, continue palpating and counting the pulse for another minute or longer as needed. Inform the client of the result. Record the findings. Following pulse assessment, respiratory rate is observed without alerting the client, as this ensures a more natural breathing pattern. While the fingers are still positioned on the radial artery, begin observing the client's respirations. Note the rise and fall of the chest. Using a watch with the second hand, count the number of respirations for 1 full minute. Assess and note the rate, depth, rhythm, and any other notable characteristics. If any irregularities are observed, continue counting the respirations for another minute or longer as needed. Inform the client of the result. Record the findings. After assessing respiration, preparation for blood pressure measurement begins by locating and exposing the brachial artery. Select the appropriate arm for application of the blood pressure cuff. Ensure the client is in a comfortable lying or sitting position. Palpate to locate the brachial artery. Center the bladder of the cuff over the brachial artery, approximately midway on the arm. The lower edge of the cuff should be positioned 2.5 to 5 centimeters above the inner aspect of the elbow. Wrap the cuff around the arm smoothly and snugly. Verify that the needle on the aneroid gauge rests within the 0 mark before proceeding. Before auscultating for blood pressure, estimate the systolic pressure by palpation. Palpate the pulse at either the brachial or radial artery using the fingertips. Tighten the screw valve on the air pump to prepare for inflation. Inflate the cuff while continuing to palpate the artery. Take note of the reading on the gauge at the point where the pulse disappears. This indicates the estimated systolic pressure. Deflate the cuff completely and wait for 15 seconds before proceeding with auscultation. After estimating the systolic pressure, proceed with auscultating to obtain an accurate blood pressure reading. Position yourself no more than 3 feet from the gauge for clear visibility. Place the stethoscope earpieces into the ears, directing them forward into the ear canals for a proper fit. Place the bell or diaphragm of the stethoscope firmly, but gently over the brachial artery. Avoid applying excessive pressure and ensure the stethoscope does not touch clothing or the cuff. Inflate the cuff to 30 millimeters of mercury above the estimated systolic pressure. Then slowly release the valve, allowing air to escape at a rate of 2 to 3 millimeters of mercury per heartbeat. Observe the gauge and listen carefully. The first faint but clear tapping sound that gradually increases in intensity marks the systolic pressure. Note the point at which the sound becomes muffled and the point at which it disappears completely. These indicate the diastolic pressure. Record this as a diastolic reading. Release any remaining air quickly and completely. If the reading is suspicious or unclear, repeat the measurement after waiting 30 to 60 seconds to allow normal circulation to return. Be sure to deflate the cuff fully between attempts. Remove the cuff, clean the equipment, and return to its proper storage. Document all findings according to institutional policy.